major question that we've had. If the Donald Trump administration repeals Obamacare, what would it get replaced with and what would happen to people's health insurance? Well, most Republicans who want to repeal have really no plan for a replacement. Donald Trump talked about repeal and replace at his address on Tuesday, but he didn't actually propose a plan to replace the Affordable Care Act. However, there is actually a Republican congressional leadership proposal about the plan. It's very similar to what Paul Ryan proposed last year, and it has leaked, and much of it is not at all surprising. The health research firm Avalere Health and the consulting firm McKinsey and Company analyzed the plan. Big surprise, the report implies that millions of people would end up without health insurance coverage if this leaked plan were to be made the replacement to the Affordable Care Act. The core action of the Republican plan that leaked would get rid of income-based tax credits, which help poor people, and replace them with these nonsense age-based tax credits, which give people the same amount regardless of income. If the main issue is some people based on their income can't afford health insurance, then you should target the credits towards people based on income. And the effect of this in your sort of average hypothetical state that has done the Medicaid expansion under Obamacare and has about 300,000 people in the individual market, enrollment as a result of this leaked Republican replacement to the Affordable Care Act, enrollment would drop 30% and 90,000 people would lose coverage. This roughly equates to millions of people losing coverage throughout the country as a whole. From the report, we have a couple of graphics from the report. As you can see, if you look at the image on the right, individual market enrollment would drop very, very significantly. Another 115,000 people, in addition to these numbers, would probably lose coverage because they're on Medicaid and wouldn't be able to find an affordable private plan if the Medicaid expansion was undone. And losses of coverage could be even worse in states that didn't expand Medicaid. By the way, most of those states are Republican controlled. In states like that, and we have another graphic to show you, in the states that did not do the Medicaid expansion, this leaked Republican plan could lead to a 50% drop in coverage. If you look again at the box on the right, it suggests 130,000 existing enrollees would no longer be able to afford a plan in non-expansion states. This is a huge problem. But in addition, you also need to add to this that if you repeal Obamacare, 70 million Americans that rely on Medicaid, half of them children, many disabled people, may not have coverage. Doesn't really sound pro-life to me, does it?
Not at all. And the Republicans will have to come up with something. The ball is in their court now. And if they don't, or if they come up with something bad, many of their constituents are going to stand to lose their coverage because some of them are on the Medicaid expansion. It was very easy for them to try to come up with a way to repeal and replace Obamacare when Obama was in office.
Yes.
And of course, that legislation was never going to get passed. Now that it actually will, they got to come up with something good.
When you've got a Republican president, House, Senate, and by and large, a lot of Republican governors, what Democrat can you find to blame if you lose your coverage in the situation we have now? Last thought on this. The Republicans talk about marketplace solutions. If you believe that there should be some areas of life that are not market solutions, but that the government handles, like, for example, roads or education, military, etc., once you concede that there are some aspects of society that the government should handle rather than the marketplace, if you want health insurance to be a market situation, you need to justify why that makes sense. And the data don't justify it. And we need to continue to demand that Republicans explain, if you're okay with anything not being a marketplace solution, even roads or education or the military, prove that health insurance should be a market solution. I've not heard one convincing argument since. And this is something that's being discussed on our Reddit discussion forum. I encourage you to join us there. davidpakman.com/REDDIT. Gamefly is sort of like Netflix for video games. They have over 8,000 new and classic games for Xbox One, Xbox 360, PS4, PS3, Wii, and a bunch of other platforms. And you can play as many games as you want for one monthly fee. And if you find some games you want to keep, you can buy them for a low used price. There's never any due dates or late fees. And our audience can get a free 30-day trial at gameflyoffer.com/TDPS.
The games are shipped directly to you with return envelopes included. There's no contracts, and you can rent games through the mobile app. Get the free 30-day trial for the David Pakman Show audience and support our show by going to gameflyoffer.com/TDPS.